Endometriosis is when the lining of the uterus, the endometrial tissue, becomes established someplace else in the body, usually someplace in the abdominal cavity, but it could be just about anywhere. It's it kind of implants and grows someplace else. Sometimes it even gets above the diaphragm. Now, uh, probably fairly common. They don't really know that much because it's very difficult uh, to diagnose conclusively because you need to do a laparoscope, and that's an invasive thing. Uh, so, so the, they're taking guesses, 10 to 20% of fertile women in North America. Um, but it's hard to say because not everybody with endometriosis has any symptoms. Uh, some say that there's someplace around 5.5 million. So it's one of these things. They don't know. Uh, but it is reasonably common. Okay, so what's going on here? What it is an implantation and growth of these cells outside of the uterus. Like I say, usually in the pelvis. And there's a couple of hypotheses as to how it happens. One of the hypotheses that really is a very popular one is that that it's from some sort of retrograde flow through the uterine tubes. So during menstruation, as the endometrial lining is sloughing off, the pressure in the uterus backs up, especially if there's a tampon or it's not allowed to flow freely, and it backs out the fallopian tubes, and really goes into the abdominal cavity around the ovaries, and that somehow these cells then become established anywhere where there's a blood supply, and they start growing there like it was the inside of the uterus. There's a couple of problems with this idea. One of the problems is that really 90% of women have this retrograde flow at some time during menstruation, and not everybody gets endometriosis, obviously. So, it also doesn't explain very well how it gets above the diaphragm. Like some people get endometrial tissue right into the brain. So, yeah. Some sources think that it's spread lymphatically or through the circulatory system, much the same way that cancer might metastasize. Now, with that said, it's not cancer. This is a colony of cells that grow ectopically. So there's a similarity to metastasis in the way it's spread, not in its effects. Other theories include metaplasia, that somehow hormonally other epithelial tissue starts to think that it's a stratum functionalis and starts to grow as endometrial tissue, and it's really metaplasia of a serous membrane or some other epithelium, and that's probably a pretty good theory. It actually may be a combination of all of those things. But the metaplasia theory is gaining ground, as far as I understand, anyways. Now, for this metaplasia to happen, somehow these cells have to A, be stimulated to change, and B, not get removed by the natural killer cells in the cytotoxic lymphocytes. So so the people that are prone have something to do something different in their immune system. They tend to have more inflammation, more prostaglandins, which is an inflammatory chemical, and they produce more scar tissue in response uh, to problems. Um, Prostaglandin also causes pain, so it can account for the pain and cramping. There's thoughts that there could be like a genetic predisposition to this based on immune system parameters, that you do inherit your immune system. So if uh, if it's a malfunctioning of the immune system that allows this to happen, then maybe endometriosis is inherited. And again, there is evidence that it runs in families. So, what's going on? The endometrial growths become established on the uterine tubes, on the ligaments that suspend the ovaries and the uterus, so the mesovarium, the mesocecal pinks, so the whole broad ligament, around the colon or the bladder. So it could be in the pouch of Douglas there, which is um, the one that's between the uterus and the rectum, or it could be in the anterior pouch between the bladder and the uterus, so the metrocystic pouch. Those are the common places for it to happen, but it can happen right on the ovaries. It can happen on up and behind the belly button and the umbilicus. It can happen all over the place, including above the diaphragm, like I said before. So the signs and symptoms are really variable with people. One of them is often infertility, and it's because of growth and scarring on the fallopian tubes. So it makes it difficult to become pregnant. A lot of times, women get the diagnosis of endometriosis as they're investigating fertility issues. So you can imagine that there'll be menstrual irregularities. There's going to be more pain because it's happening elsewhere. It's an interesting thing that there are people with a huge number of symptoms that don't have very extensive growth, and there are other people that have hardly any symptoms that have huge amounts of growth. There doesn't seem to be a correlation. So what's can happen here is because of scarring, you get these fibrous connective tissues, which are scar, and it can cause adhesions. It can be really quite nasty if it happens in the pouch of Douglas between the uterus and the bowel. It can cause the uterus to kind of adhere to the bladder, which is not good for either of those organs. It can lead to anemia because of the amount of bleeding. It can lead to a condition called uterine hyperplasia, which is an overgrowth of the endometrial tissue within the uterus, and it's got to do with hormones. So the hormones become excessive, and then that becomes a problem. Back when I was a student, I asked a question of my pathology prof whether uh, there was an increased risk of ectopic pregnancy, tubal pregnancies, and things like that, because more of a chance to implant an ova on endometrial tissue if the ova doesn't end up in the uterus, in the body of the uterus. So, and he told me unequivocally, no, that's not it. Well, in the intervening 30 years since I took it, it seems that the evidence is pointing that can be a complication. Ectopic pregnancy is possible. So the only way to really find out whether you have it is laparoscope. What they do is they'll put a little hole in the belly button and feed in a scope, and then they blow a whole bunch of gas in, and so that uh, the abdomen blows up like a balloon, and there's space between all the organs, and then they have a look around and they look at it. There's It really doesn't show up very well on ultrasound or even MRI. There's a lot of false positives. It's the only really definitive way of doing it is to get in and have a look at it. So what do they do for these people? Well, one of the main things is to help treat the symptoms, so relieve the pain. They also try and stop progression, and so they can do that hormonally and that kind of thing. They want to prevent new growths. There are treatments that, maybe surgical treatments, that will restore fertility if there's blockages. So there's been a lot of attempts at laser cauterization for ablation of the growths. What they do is, with a laparoscope, they go in and they literally burn off any of the places that are showing signs of this. It's interesting that it seems to go away when people are pregnant. So by hormonally mimicking pregnancy, it can slow the progression and ease the symptoms. Most people, though, just go with non-steroidal anti-inflammatories and as painkillers. Now, oftentimes people go through all of these treatments leading up to surgery, leading up to ablation. So one of the relative contraindications for massage in this is that if there are adhesions, if there's problems that way, and so you have to be very careful, and so you have to be conservative about any abdominal work that you're doing. But other than that, it's just stress relief and that kind of treatment.